We are in uncertain times. It's the unseen enemy. The COVID-19 pandemic is sweeping the globe with fear riding shotgun. The virus originated in the province of Wuhan, China, which could not contain the contagion until it was too late. Much like the genie in the bottle, once it's out, it's not going back. So dramatic are the losses that Italy saw more than 600 deaths in just one day. In Spain, more than 420 in 24 hours. Hello and welcome to the Unpublished Cafe. I'm Ed Hand. We're coming to you from a remote location and practicing social distancing in order to protect everyone. The latest with COVID-19, and we're recording on March 21st. Canada is closing in on 1,000 cases with 10 deaths so far. Dramatic measures have been implemented in Canada to try and slow the spread of the virus. The Canada-U.S. border is closed to all but essential travel. Bars, restaurants, stores closed with the exception of grocers and pharmacies so Canadians can get essentials to survive during self-isolation. That in itself is a fairly new addition to our lexicon, as Canadians right up to the Prime Minister are in self-isolation for, in this case, his wife was diagnosed after a flight to Britain. With tens of millions of Canadians staying home, schools closed, business as we know it grinding to a halt, the economic impact has been devastating. This week, the stock markets suffered its worst loss ever. Ever. Think about that. Bigger than 9/11. Bigger than the economic crash of 2008. The federal government's announced an $82 billion aid package for Canadians and businesses to weather the pandemic storm, but many money minds see this as a first step back and a long road. To paint the picture with numbers, last year at this time, 27,000 Canadians filed for EI benefits. This week alone, that number is ballooned to 500,000. Today on the Unpublished Cafe, we'll take a look at the psychological impact of the pandemic, which at one point was embodied by the hoarding of all things toilet paper. Dr. Paul Slovic from Decision Research will join us to explain the hysteria around the pandemic. As mentioned off the top, the virus originated in China, but the issue is how open and honest was the Chinese government with the world when there were consistent reports of the outbreak and the country's inability to contain it. Marcus Kolga from the Macdonald-Laurier Institute will join us to discuss how the world may reckon with China that played fast and loose with crucial information. We begin the show with a look at the economic impact of COVID-19. We have seen nothing like this in my lifetime. The lion's share of business in Canada has ground to a halt. All but essential services are operating. For employers and workers in Canada, this is uncharted territory. No work, no income, and no certainty. The federal government has called on the manufacturing sector to retool to produce much-needed healthcare equipment. Now, joining us on the Unpublished Cafe, Ryan Mallow is the Ontario Director of the Canadian Federation of Independent Business. And Ryan, I want to thank you for joining us.
Thanks for having me.
I would imagine your membership is quite nervous right now.
Yeah, they're very concerned. We're hearing an unprecedented number of calls coming into our lines, and we're doing our best to survey, but there is a lot of concern with what's happening out there right now.
And how does the Federation see the $82 billion federal package to help?
So I think the federal government has done a good job in responding to the health side of this crisis. When it comes to the economic side, I think we've seen a lot of steps in the right direction, but I don't think that we have seen the size and the scope we're looking for based on what we're hearing on the ground.
And in that case, what are you hearing on the ground that makes you think that this might not be big enough?
Well, right off the bat, that it has to be more. I mean, we're glad that the federal government is considering a wage subsidy, but 10% is not going to be the make or break between deciding to lay someone off or to keep them on. We've seen other jurisdictions, such as Denmark, cover as much as 75%. The United Kingdom just recently announced that they're going to cover up to 80% of wages. And that's the kind of number that can say, hey, I can keep these employees on during this crisis while my sales and revenue are taking a hit. And that's important because once we're out on the other side of this, the more employers that have their employees still on the payroll, still on staff, and ready to go, the quicker we're going to be able to start the economic engine back up. If everyone's forced to go through hiring and onboarding again, it's going to take a much longer time to get things going.
It's nice to promise funding, but the key is how fast is it to get it in the hands of Canadians?
Well, and that's the other key too. And the nice thing about the wage subsidy, at least so far, the direction the government is going is that it's done through reducing the amount of income tax they're taking off of payroll, so it can be done immediately as opposed to having to wait for a bill. This is why we're also calling on governments across the country at all levels to look at the options that don't need things like emergency legislative recalls or new phone systems or application processes. Things like delaying tax remittances, particularly on sales taxes like HST, PST, GST, can keep money in business owners' pockets now and help get them the cash flow they need on the ground right away.
Ryan Mallow is joining us on the Unpublished Cafe. He's the Ontario Director of the Canadian Federation of Independent Businesses. We look at the economic impact of, at least so far, in terms of COVID-19. And I guess we should look at that so far, Ryan, because as we talk about this being uncharted territories, we don't know how long this is going to last, do we?
No, and it's sort of one of those things that's really stands out when you think about it. Is it feels like it's been a long time, but realistically, things have only sort of really started getting going, states of emergency, shutdowns and that sort of thing for about a week at this point. And we've been surveying our business members, and they have told us that they cannot take a significant hit to revenue for about more than a month. So we're really looking at a 3-week window left where governments have some time to take action and save those businesses before we start seeing closures become a little more prevalent and potentially a little more permanent.
So financially, your members were not doing well before the pandemic?
No, they were doing all right before the pandemic, but the pandemic's already having an effect. About half of businesses have already seen a significant drop in sales. 40% of those reporting a drop have seen a hit of more than 25%. And those are numbers as of last week. I can tell you we are actively surveying again. Preliminary data showing that number has spiked. So they really are feeling a pinch already from all sides.
What other support or assistance would your members like to see from the federal or the provincial government?
Well, I think there are some moves that the government can make on the employment insurance side of things. It was good to see the feds roll out a program for waiving the 1-week waiting period for anyone who is sick or isolated or taking care of someone sick or isolated. That's a positive move. It doesn't help the people who have been impacted economically by COVID-19, people who've had to shut down because of loss of business, but not necessarily illness. So expanding the programs to cover that sort of thing would be pretty helpful. We think that they should also really consider canceling planned tax increases. I mean, normally what would be pretty big news is we are 9 days out from a carbon tax increase. That's significant. That has had an impact already, and spiking that number would continue to have an impact. The CPP increased at the beginning of this year. It's set to increase at the beginning of next year. So delaying things like that would be hugely beneficial as well, again, because it would keep more money in business owners' pockets, allow them to continue to pay their employees, manage their businesses, and when we're through this, get up and going quicker.
You know, when we look at a situation like this, and let's face it, we're in a new world right now. The government, while it's doling out $82 billion in tax credits and cash, it subsides on people paying their taxes. And if that's not happening, we're looking at an even bigger deficit and debt, are we not?
We are, and it is something that is out there that governments need to consider. That we need temporary measures right now. We do need the emergency relief, whether you're an individual or a small business owner. But that being said, this is all going to come at a cost, and at some point, we are going to need to pay the piper, so to speak. And it is something that we have already heard some concern on some relief measures. It's great that the government has extended an additional $10 billion to the Business Development Bank of Canada for loans, but there are a lot of business owners looking at a loan agreement sort of uneasily and going, I'm going to have to pay this in 6 months, and I don't know if I'm going to be able to, if the economy is going to be back in a place where I can. So it's another side for the government to consider, but yes, at some point we are going to have to pay for all of this.
Ryan, I want to thank you for joining us.
Hey, thanks for having me.
Ryan Mallow is the Ontario Director of the Canadian Federation of Independent Business. When the COVID-19 pandemic hit North American shores, the reaction was fast and furious. Massive lineups at stores to stock up on supplies for self-isolation. When you would expect a run on hand sanitizers, face masks, and perishable food, It was scenes of people hoarding toilet paper that seemed to define the moment. Now, to find out more about what fueled the fear, I'm pleased to be joined by Dr. Paul Slovic. He's president and founder of the Decision Research Group and professor of psychology at the University of Oregon. And doctor, when you see the hoarding of toilet paper, we saw that all on television. What do you see about these people? It seems irrational to me.
Well, I think that they are worried about some new, very scary threat that is, about to engulf us, or at least that's what we're told. And there's a very relatively little we can do to control it. One thing we can do is to stock up on supplies of things that are important to us, including not only toilet paper, but obviously other, food items and medicines and things like that. So in a situation where we are threatened and we are searching for some way to exert control over it, buying things that we think we might need and not be able to get is one way to do this.
You mentioned control a couple of times just here, and how important is that for people when they're facing a possible risk?
It's extremely important. So I, with other colleagues, have been studying people's perception of risks from all kinds of different threats for more than 40 years. And one of the factors that's most important in determining the sense of risk and people's attempts to, react to it is whether or not they think they can control it personally, and whether or not they think that the authorities, the health officials, and the government also can control it adequately. And I think in both of these levers of control, self and government, we feel are not where they should be, not what we would like them to be. We would like to have a vaccine. We would like to have a medicine, a pill we could take that if we got this, it would make it go away. We don't have that. At the governmental level, we see that there's likely to be shortages of hospital beds and respirators and things like that. So control is lacking in a certain sense here, and that really ramps up our perception of risk.
How much of the unknown plays into the way we react to a situation like this? And I look at, and we've seen when a hurricane is going to hit the U.S., people are stocking up on plywood for their windows. They're stocking up on fuel. I guess what's coming, as opposed to, in this case, a pandemic. You don't know what's coming. That's the issue.
Yes, uncertainty is certainly central to all this. But even with a hurricane, what you see is a projected track. It's not a straight line. It's not a narrow line. It's a band. It's kind of like a funnel thing, which says, well, it's likely to go in this way, but there's some margin of error on it. But at least you have some sense of where it's going and the boundary. So it is uncertain, but it's kind of bounded uncertainty. With coronavirus, we don't know the bounds. We know that this thing increases rapidly, and we don't know. Is it going to be 30% of the population, 70%? In Germany, Angela Merkel said that she expected 70% of the population in Germany to get the virus, but so we don't know where the boundaries are because it is new and unfamiliar and extremely contagious.
Would you call these reactions hysteria?
No, I would call them fear, anxiety, which and hysteria sort of suggests that this is an overreaction. I mean, sure, some people are having strong reactions, but I mean, this is a serious threat, especially if you are older and immune compromised, or you have contact with such people. This is a dangerous thing. So I don't I don't think hysteria is the right word for it. And in fact, in many ways, people may be underreacting. They may not be taking it seriously enough. So I just saw a poll that was conducted by University of Southern California, nationwide poll of, 5,000 people. And it seemed that a high percentage of people felt that they personally were at low risk from the virus, that they were unlikely to get it. And if they got it, it would be mild. And so I think that, a lot of people feel at this point that they are, still at low risk.
Are they delusional, or is that just they're trying to be the glass is half full?
Well, the thing about the virus, which makes it so insidious and difficult, is that it is spread. We use the word exponentially. That each, on average, a person who's infected will go on to infect, let's say, 2 other people, and if each of those 2 other people infect 2 other people, then suddenly you've got it growing, 1 to 2 to 4 to 8 to 16 to 32 to 64. It's growing in what we call an exponential curve. And the thing about an exponential curve is that when it starts out, it looks very small and innocuous. And then suddenly it takes off like an explosion. And it's, each step is double what it was before, if in fact this is a doubling type of phenomenon. And so it takes us by surprise. It's kind of smolders and looks small until it isn't, and suddenly it's wildly out of control. So that's what we want to stop through social distancing and isolation, is to try to keep that from taking off the way it might. So there is that threat. So it's a very real and serious threat. And we've seen, and you see what's going on in New York City, how it's exploding out. And we see what happened in Italy and earlier in China. So that's the threat, is that everything looks kind of low key and calm until suddenly it isn't.
Can the fear that we describe be exacerbated by constantly watching and listening to news and access to social media about this?
I think that what we're hearing on the media is very, very worrisome, because the media, and I'm not saying that the media is doing the wrong thing. They are reporting the data they're getting about the increasing spread of this disease. So it's now, they report how it has spread from, the first reported case in the U.S. to, in one state, and then it spreads to other states. Now all 50 states, there's cases, and then within each state, it starts to spread. So they're reporting the spread, and what they're reporting is the number of cases and the number of deaths. They're not really focusing much on the percentage of cases that are mild, or the high percentage of people who are not infected still. So the news, they focus on the news that's worrisome and how it is spreading, and that's scary. The other thing is, we see reports, which I think are accurate, about how the health professionals are challenged in trying to deal with this, and also when they're taking care of people, they're going around in these hazmat suits, moon suits, which when you see that, that's very frightening, and shows that this is not even though early on people made comparisons to the flu, I don't recall seeing caregivers taking care of patients with the flu in hazmat suits.
Now, you are in the U.S. Pacific Northwest, and we're here obviously in Ottawa, Ontario, Canada. I'm kind of curious, what's the state of Oregon today?
I think we've got about 60 cases, and that has grown rapidly in the last week. I think our governor is right on top of this, taking very strict measures. I mean, all the schools are closed. All the universities are shut down. The final exams for spring term on the people university on the quarter system have all been are being done remotely, and then next term, if the universities will so far operate, but there will be no person-to-person classes anywhere in Oregon, and other. Other strong steps are being taken to shut down non-essential businesses and to try to motivate strongly the social distancing. So things are quite shut down here.
Dr. Slovic, I want to thank you for joining us.
You're welcome. Nice to talk to you, Ed.
Dr. Paul Slovic, president and founder of Decision Research and professor of psychology at the University of Oregon. While the world wrestles with the COVID-19 pandemic, China, the epicenter, has seen its infection rate slow to a trickle. That can describe China's initial attempt at stopping the outbreak and informing the world, according to some. Marcus Kolgas is strategic digital communications strategist, human rights activist, and expert on foreign disinformation. He's a senior fellow at the Macdonald-Laurier Institute's Center for Advancing Canadian Interests Abroad, and he joins us now. And Marcus, you wonder how Canada and other nations could even address China on this.
Well, it's something that we're eventually going to have to think very hard about. A lot of people have questioned whether we should be holding China accountable, or whether we should even be considering this question at the moment. And of course, we need to focus on combating the virus. So, flattening the curve and getting through this, definitely. But we also need to start thinking about how we're going to pay for this, because the toll, both in the number of people who are sick, the work that's being missed, hopefully the death toll isn't going to be too high, but the economic cost of all this. Eventually, we're going to have to consider all of that, and I think the toll is going to be awfully high. And the question will be who's going to be responsible for it. And I think the Chinese government, not the Chinese people, I should be very clear, but the Chinese government, in their failure to contain this outbreak in November and December, and spreading misinformation about it, both internally and externally, that really helped enable the current pandemic. And so I think it's something that needs to be considered in the long run, again, to address the toll that we're going to be facing.
So from your perspective, you would lay the blame on the Chinese government for responsibility?
Well, I think we need to look at it. I mean, we don't have all the information yet as to what happened. I was in Taiwan in early December, and I recall seeing on the news that in Taiwan, they were already sealing off the borders to any flights coming from Wuhan. And the Chinese government knew about this in probably mid-November, late November.
Yeah.
And so, their failure to properly contain it is a problem. But, I think it's going to take a bit of study, and we're going to have to investigate as to how all of this happened, what the chain of events were like. And that's going to be a bit of a longer term process. But we need to look at that and consider whether the Chinese government was responsible for this.
What did the Chinese government have to gain by not coming clean with the rest of the world about what it was dealing with?
Well, I'm not sure whether they considered the rest of the world in much of this in the beginning. This is a totalitarian communist state, and the way these states work, or at least the officials who work for the government, how they work is that they try to escape any responsibility for any sort of problem, even if it's a health crisis, because there are always consequences. Arbitrary detention, jailing, torture, God knows what. So it's in the interest of those officials to sort of hide any sort of issues that might emerge. So this is how things progressed internally. Externally, China wants to deflect any responsibility for this because it's, damaging for the reputation of their brand. And the Communist Party itself in China bases its power on the fact that it's infallible, that it makes no mistakes. So having anything pinned on them is really problematic for them in the sense of staying in power. So they're going to do all they can to deflect any responsibility from this externally right now. And we're seeing that with these disinformation campaigns that are emerging. We know that the Russian government already early January planted stories about about COVID-19 being a U.S. Army developed virus and part of their biological warfare toolkit. And this is something that the Chinese government now is publicly, it's a narrative that they're publicly pushing. So I'm not sure how much they have to gain, but I think that the Chinese government thinks there's a lot to lose by taking any responsibility for this, for the pandemic.
What does the Russian government gain by laying the blame on the U.S.?
Well, that's not their only narrative that they're trying to push. The European Union just warned last week that they are pushing narratives, all sorts of narratives. Some of these nonsense about drinking bleach that will help cure you. Various different alternative cures for the virus. Telling people that it's not that big of a deal, that they don't need to take precautions. There's a whole slew of narratives that they have out there. But their objective in all of this is to destabilize and wreak havoc on Western society. And the EU is terribly not even disappointed. I mean, they're enraged by the fact that the Russians have been doing this, or the Russian government has been doing this since January, and they need to stop. And this is something that the Canadian government also needs to start addressing, because all of these conspiracy theories and disinformation, they trickle down to us as well in Canada. In fact, there's a well-known conspiracy theory website, Global Research, based in Montreal, that's been one of the main sources of this disinformation being pushed out globally. And so we need to do more, our government needs to do more in raising awareness among Canadians about these sorts of attacks. The Europeans are doing it quite well, and we know the Taiwanese do it very well. We need to start doing it as well to start protecting Canadians.
Marcus Kolg is joining us on the Unpublished Cafe, strategic digital communications strategist, human rights activist, and an expert on disinformation with the Macdonald-Laurier Institute. And Marcus, what would the world look like to you if China had been honest with the rest of the world when this first started?
Well, I think we have a pretty good example of what may have happened if we look at Taiwan. So I mentioned earlier that I was in Taiwan early December. We didn't know, I didn't realize what was going on. It's only later that I realized why they were doing what they were doing with regards to banning flights from Wuhan. But the Taiwanese government, when they detected that there was a problem, they used the experience that they had during the SARS outbreak, and they immediately started closing their borders. They started taking proactive measures to ensure that anyone who was feeling sick was identified, and that and people were self-isolating. And they made sure that information about the outbreak was made as public as possible. They had these great public awareness campaigns where they used cartoons and such to inform the public about what to do and how to stay safe. And this was all done early in January. So they were really quick to do this, whereas the Chinese government has done little more than deny responsibility, obfuscate, probably fudging the numbers. I mean, I'm not sure that, I know that everyone's reporting that China is down to, a zero death rate right now over the past couple of days. I'm not sure that we can trust those numbers based on the Chinese government's past record on disinformation. But I would look to the Taiwanese, and this is a group that we can learn from. And there is right now there's a new working group, a U.S. government Taiwanese working group that was just announced, I think 3 days ago, on COVID-19, how to address the current problem, to learn from the Taiwanese on how to tackle it right now, but also in the future. And the Europeans just announced, I think overnight, that they would also be working officially in an official capacity with the Taiwanese government on COVID. And this is something that the Canadian government, they shouldn't worry too much about Beijing's intimidation, because the Chinese government doesn't want us recognizing Taiwan or anything about Taiwan or working with them at all. And we need to get over that and join the Europeans and Americans in working with the Taiwanese to get over this crisis. If we don't do it, we'll be left on our own. And we really should be learning from the Taiwanese, given their success in tackling this pandemic.
What kind of reckoning do you see for China when this subsides?
That's a good question. That's really the $1 or billion question. I think we need to start looking at how responsible certain officials were, agencies within the Chinese government. I think that we need to start considering the application of sanctions. We have, of course, Magnitsky human rights sanctions that could be purposed for this. Those individual officials, who are involved in disinformation campaigns and such, seizing their assets in Canada and ensuring that they can't travel to this country. That's the first thing that we can do, and that's rather easy once we figure out who these officials are. The other thing that we need to do is, certainly looking down the road is, make sure we diversify our trade and not rely so much on China because, we have been bullied by them considerably over the past number of years, certainly over the past 12 to 24 months. In the most extreme case, if we're seizing assets, we need to look at repurposing them. Lloyd Axworthy and Alan Rock have brought forward a proposal to the Canadian government just after the election or just before the 2019 election to do just that, to take assets seized by our sanctions regime and repurpose them to support humanitarian efforts and such. And so this is something that we can sort of look at and perhaps even use those two former ministers' proposal and rework it so that it helps us overcome the massive economic burden that we're going to be facing in the wake of this pandemic. So there are a few things that we can do, but I think we need to give a lot of thought as to how we do that and hold the Chinese regime accountable.
Marcus, thank you for joining us.
Thanks so much for having me on, Ed.
Marcus Kolga is a strategic digital communication strategist, human rights activist, and expert on foreign disinformation, as well as a senior fellow at the Macdonald-Laurier Institute Center for Advancing Canadian Interests Abroad. These are trying times, to say the least. The economy virtually shut down. Canadians locked in their homes, fearful of even their neighbors. All but essential services shuttered, all aiming to quell the spread of the COVID-19 virus. We're in a world now of self-isolation and social distancing. For how long, it's not clear. I want to thank my guests, Ryan Malol of the Canadian Federation of Independent Business, Dr. Paul Slovic of Decision Research at the University of Oregon, and Marcus Kolga of the Macdonald-Laurier Institute. And I want to thank you for listening to the Unpublished Cafe. Stay safe. I'm Ed Hand.